In this video, I would like to outline important guidelines you should follow in the immediate period after your weight loss surgery. The first thing I would like to talk about is diet and hydration. You will be starting liquid diet immediately after your surgery. Ingesting liquids as soon as possible after surgery has been proven beneficial for the recovery and will reduce nausea. As soon as you're given an okay to drink, you should take small sips of water, diluted apple juice, and broth. Initially, for the first 24 hours, you will be limited to 1 to 2 ounces per hour, but later on you should increase your intake to 30 to 50 ounces of fluid per day. You should drink slowly as if your liquid is extremely hot. This will help prevent excessive filling of your new stomach. Staying hydrated is very important after surgery. If you are unable to drink due to nausea, you may want to try an anti-nausea medication that will be prescribed to you. And if that doesn't help, please call me immediately. Avoid carbonated beverages and beverages that are too sweet. You may drink juice, but it's best to dilute it with water. Skim milk, almond milk, and soy milk are all okay. You should avoid caffeinated beverages at least for 1 week after surgery. You can also consume Jell-O and pudding. Other fluids that are recommended include diluted low-sodium V8 juice and Crystal Light. You must avoid soda or any other beverage with a high sugar content. It is also important if you record the amount you drink per day and keep track of your fluid intake. It is also critical to monitor yourself for signs of dehydration, such as dark urine, dizziness, fatigue, dry mouth, and irritability. If you notice any of the signs, you should try to increase your fluid intake immediately and contact me if you are unable to do so. Protein supplements should be started on the second day after the surgery. I recommend powder protein supplement that you can mix yourself because they allow you to adjust the taste, thickness, and flavor. You should purchase a blender to be able to make your own shakes. Your taste buds will change after the surgery, so you may want to experiment with several shakes before you find the one you really like. Choose the protein powder with the least amount of sugar. Your body will need about 40 to 60 grams of protein daily. All protein powder supplements will have an indicator on the label on how much protein each scoop contains. Some of the protein shake making strategies could include mixing the protein powder with almond or soy milk, as well as adding a small amount of fruit or peanut butter. You can add some ice too to make a smoothie. If you are deciding to purchase a pre-mixed shake, please choose the variety that contains fewer carbohydrates. Pre-mixed shakes also have the amount of protein listed on their labels. Please note that the protein amount is usually listed per serving, and each bottle can contain 2 or more servings. You will be on this liquid diet for 1 week if you had a gastric bypass or sleeve, and for up to 3 weeks if you had a gastric band. After the liquid diet, you will be advanced to soft food. The details of the soft food diet are available on my website. You should make your first post-operative appointment 1 week after surgery so we can discuss the next step in your diet. Vitamins should be started as soon as you arrive home from surgery. I recommend that you use chewable vitamins. You should take 1 vitamin per day, as well as 1 B complex and 1 biotin daily. You should also start taking calcium and vitamin D once or twice a week. After 1 week, you should add iron supplement and take it at least twice a week. Iron can be really hard on your stomach and can also cause constipation, so it is better that you start taking it 1 week after surgery and not right away. Now let's talk about physical activity. Your pain after surgery should be really minimal, and you should be able to gradually increase your physical activity immediately after surgery. It is critical that you walk as much as possible without, of course, overexerting yourself. It is best to take short 15-minute walks every couple hours to keep your blood circulating and to prevent blood clots. You can also do some light stretching and breathing exercises. Please avoid heavy weightlifting and more intense exercises until you are cleared to do so after your first post-surgical visit. Return to work and driving will depend on your recovery, and I will be happy to discuss this with you individually. As far as your medications are concerned, you will be prescribed a pain medication, an anti-nausea medication, and a medication to help heal your stomach, and a medication to prevent gallstones, unless of course you had your gallbladder removed earlier. The instructions on how to take these medications will be provided to you at the time of discharge. Some patients may be prescribed an injectable blood thinner, which they will need to take after the surgery on a daily basis for 2 to 4 weeks. If you are already taking medications before the surgery, you will be provided instructions on which of them you will need to continue. As far as the size of the pills, if they are smaller than a dime, you can swallow them whole, and if they are bigger than a dime, you can break them in pieces, but you should not crush the medications. If you take medications in a capsule form, it is okay to swallow the entire capsule. If you are diabetic, your blood sugar after the surgery may be lower than it was before the surgery. It is important that you check your sugar on a regular basis after your procedure. Please contact my office or your primary doctor if you're not sure about your medications after your surgical procedure. Complications can happen even after you leave the hospital, so it is very important to monitor yourself at home after the surgery. Please call me immediately if you develop such problems as fever, severe fatigue, shortness of breath, chest pain, abdominal pain, or vomiting. You should also promptly report any leg swelling or pain, diarrhea, or severe constipation. While it is normal to be somewhat constipated after surgery, not having a bowel movement for 3 days or longer after the procedure is a reason for concern, and you should call me about this immediately. Finally, this website contains valuable resources regarding your postoperative diet, protein, vitamin supplementation, as well as sample menus. The diet guidelines can be found in resources/downloads in this section. It would be my pleasure to answer any questions you may have. Please don't hesitate to contact my office at any time. Thank you.